The Vein Center in Cosmed recently has taken over a very, very successful and long-lasting diet program that was available at Barnes Hospital for approximately 25 years. That diet is called a modified, fast, protein-sparing diet. It is for people who are grossly overweight. It is a diet that has a drastic decrease in caloric intake without the possible side effects or the possible ramifications of not having enough calories and thereby losing muscle mass, which a lot of low-calorie diets can result in. If we lose enough muscle mass, it can also affect the heart because the heart is muscle. So instead of losing weight, which is just fat, people would lose weight in their arms and their legs and other muscular areas because they're not getting enough protein in these low calorie diets. This protein sparing, almost fasting diet, the Medi-Cal diet that we now have at the Vein Center in Cosmed, is a drastic reduction in caloric intake, only approximately 500 calories a day. And if those rules are obeyed, people can lose 4 to 10 pounds a week. And usually these are people who absolutely need to lose multiple pounds. People who are considering bariatric surgery, which can be avoided. People who may need an operation for other things where losing weight would be mandatory beforehand. People who are diabetics, people who have high blood pressure, people who have joint problems, and they're maybe 50, 60, 75 pounds at least overweight. This diet is very fast. It's relatively simple because you don't have to make any decisions about what you eat. And it's been proven to work over the last 25 years, and it's sort of getting a resurgence recently. And we have agreed to be one of the sponsors of that diet and to provide it here with physician supervision. And we follow the patients through all aspects of this diet, which has multiple different levels. And we certainly keep contact with the patient's physician and their medications, and we let their family doctors know what's going on and how much weight they're losing and whether or not any of their medications need to be modified in any way. So it's a difficult diet at the beginning because it is so drastic, but once the first week has passed, people love the fact that they've lost 10 or 12 pounds, and it becomes much easier. And believe it or not, people don't get hungry on this diet. So we're happy to provide this particular diet program to people who really need it.